This is Community Connection.
Thanks for joining us on today's Community Connection. I'm Jason Laird, joined by Teddy with the City County Health Department, and here to talk about Healthy Lives, Vibrant Futures. Tell me a little bit about what that organization and group is all about.
Well, it's a coalition made up of several entities here in the city that we try to get the word out about living a little better and being a little healthy in our choices that way, such as foods and exercise, so on and so forth.
Just overall healthy life.
Absolutely.
And one thing, speaking on healthy life, that's really been in the news lately is vaping and e-cigarettes. So that's kind of what we're here to talk about a little bit today.
Absolutely. We're finding that the electronic cigarettes is a boom industry that way. Since the numbers are down on smoking as such, a lot of folks have turned to vaping in place of that. We're hearing a lot of myths that way, as they're more healthy for you and things of that nature. And we're finding that's not the truth that way. We're finding a lot of respiratory problems, especially in our younger people. A vast majority of our users we're finding is between 18 years old to 30 years old.
Oh, wow.
Yes.
So a much younger audience in a sense that is kind of getting into it. And what are some of the, I guess, misconceptions that a lot of people think about or might come across when talking about vaping or e-cigarettes?
Well, it started out as what they called a cig-alike, as you can see.
Kind of looked like a cigarette.
Shaped the whole bit. But then they've progressed into what we call mod boxes, or box mods, either way. These can be filled with an e-juice that a person could make up. And all of these would contain nicotine. And the crown jewel of them all is called the Juul, which is what they call a pod system. It's the same thing as the tank here, but this contains at least 55 milligrams of nicotine.
Wow. So how does that compare to like a normal cigarette?
A normal cigarette would have between 11 to 13% of nicotine in it that way.
Really?
Yes.
So that's, I mean, almost 5 times in a
Absolutely.
sense. That's pretty
Absolutely.
impressive. So it's really not that just people are bringing in vapor per se, it's the fact that there's all the extra chemicals associated with it.
Absolutely. And that's another misconception. They're called vapes or vapors, but it's actually an aerosol that people are ingesting that way. Aerosol would continue to hold those chemicals for a lot longer in the lungs.
Interesting. So it's actually kind of enhancing the effect in some ways.
Absolutely.
Really?
Yes, it is.
So now somebody who's trying to maybe dig up or look up a little bit more information on this, where should they go? How should they go about getting that information?
You can always turn to the CDC, American Cancer Society, American Lung Association, and I have quite a bit of information on it as well since 2007 when they were actually hit our shores that way.
Because it's still pretty, I mean, in the big scheme of things, it's still pretty new. So, I mean, a lot of that research is continually being developed and changed and whatnot. And what are some of the big things that have kind of changed over the recent future that maybe folks thought were safe and now not so much?
I think that the chemicals that you're finding in our regular tobacco products, you're still going to find them in here. There's over 4,000 chemicals in those tobacco makeup that way. So they're just transferring that to another product that way.
That makes sense.
So we don't want people to be fooled that these are less harmful at all.
Makes sense. Well, Teddy, thank you so much for coming in and kind of giving us a little bit of an in-depth look at e-cigarettes and some of the causes there. And of course, all the details to get more information will be up on your screen. Thanks again.
You bet.